Welcome back to MCQs Master 101, where average preparation ends and elite NCLEX mastery begins. Today, we're diving into one of the most tested and most dangerous topics on the NCLEX, shock and sepsis. This is not basic med-surg. This is critical care thinking. We're talking hemodynamic interpretation, MAP prioritization, lactate trends, vasopressor decisions, early versus late septic shock, cardiogenic versus hypovolemic traps, neurogenic shock confusion, and real ICU level prioritization. These 50 questions are designed to challenge your clinical judgment, not just your memory. If you can think through these scenarios under pressure, you're not just preparing to pass the NCLEX, you're preparing to think like a critical care nurse. Get your notebook, stay focused, and let's go save some lives. Question 1. A client with suspected septic shock has the following findings: BP 82 over 48 millimeters of mercury, HR 128 per minute, RR 30 per minute, lactate 5.2 millimoles per liter, urine output 15 milliliters per hour. Which prescription should the nurse implement first? A. Start norepinephrine infusion. B. Administer 30 milliliters per kilogram isotonic crystalloid. C. Obtain blood cultures. D. Administer broad-spectrum antibiotics. Answer. B. Administer 30 milliliters per kilogram isotonic crystalloid. Rationale. Septic shock requires rapid fluid resuscitation first to restore perfusion. Vasopressors are started only after adequate fluid resuscitation if hypotension persists. Cultures and antibiotics are essential but do not immediately correct life-threatening hypoperfusion. Question 2. A client in cardiogenic shock has BP 78 over 40, HR 118, PAWP 24 millimeters of mercury, crackles bilaterally. Which intervention is priority? A. Administer IV fluid bolus. B. Start dobutamine infusion. C. Elevate legs. D. Administer furosemide IV. Answer. B. Start dobutamine infusion. Rationale. Cardiogenic shock with elevated PAWP indicates fluid overload and poor contractility. Dobutamine improves cardiac output. Fluids would worsen pulmonary edema. Question 3. A trauma client develops cool, clammy skin, BP 84 over 50, HR 132, narrowed pulse pressure. Which type of shock is most likely? A. Neurogenic. B. Septic. C. Hypovolemic. D. Anaphylactic. Answer. C. Hypovolemic. Rationale. Cool, clammy skin and tachycardia indicate compensatory vasoconstriction typical of hypovolemic shock. Neurogenic shock presents with bradycardia and warm skin. Question 4. A spinal cord injury client at T4 has BP 78 over 44, HR 48, warm, dry skin. Which medication should the nurse anticipate? A. Epinephrine. B. Atropine. C. Furosemide. D. Sodium bicarbonate. Answer. B. Atropine. Rationale. Neurogenic shock causes loss of sympathetic tone, leading to bradycardia and hypotension. Atropine treats severe bradycardia.
Question 5. A septic client's MAP is 60 mmHg despite fluids. Which action is next? A. Discontinue IV fluids. B. Start norepinephrine. C. Administer sodium bicarbonate. D. Restrict fluids. Answer. B. Start norepinephrine. Rationale. Vasopressors are initiated when MAP remains less than 65 mmHg after adequate fluid resuscitation. Question 6. A client receiving norepinephrine develops infiltration at the IV site. What is the nurse's first action? A. Stop the infusion. B. Apply cold compress. C. Elevate the extremity. D. Flush with saline. Answer: A. Stop the infusion. Rationale: norepinephrine extramization can cause severe tissue necrosis. The infusion must be stopped immediately. Question 7. Which laboratory finding best indicates worsening septic shock? A. Lactate 6.0 millimoles per liter. B. WBC 14,000 per millimeter cubed. C. Platelets 180,000 per millimeter cubed. D. Sodium 138 milliequivalents per liter. Answer: A. Lactate 6.0 millimoles per liter. Rationale: elevated lactate indicates tissue hypoxia and poor perfusion, a hallmark of worsening septic shock. Question 8. An anaphylactic shock client has wheezing and hypotension. Which medication should be administered first? A. Diphenhydramine. B. Methylprednisolone. C. Epinephrine IM. D. Albuterol nebulizer. Answer: C. Epinephrine IM. Rationale: epinephrine reverses airway edema, bronchospasm, and hypotension. It is the first-line treatment. Question 9. Which hemodynamic finding is expected in early septic shock? A. Decreased cardiac output. B. Increased systemic vascular resistance. C. Warm flushed skin. D. Low heart rate. Answer: C. Warm flushed skin. Rationale: early septic shock is distributive, causing vasodilation and warm skin. Cardiac output is often elevated initially.
Question 10. A client in hypovolemic shock has ABGs pH 7.30, PaCO2 32, HCO3 17. What is the interpretation? A. Respiratory alkalosis. B. Metabolic alkalosis. C. Metabolic acidosis with compensation. D. Respiratory acidosis. Answer: C. Metabolic acidosis with compensation. Rationale: low pH and low HCO3 indicate metabolic acidosis. Low PaCO2 shows respiratory compensation. Question 11. A client with septic shock has received 3 liters of normal saline. Current findings: MAP 58 millimeters of mercury, CVP 10 millimeters of mercury, lactate 4.8 millimoles per liter. Which action should the nurse implement next? A. Administer additional 1 liter NS bolus. B. Start norepinephrine infusion. C. Administer packed RBCs. D. Restrict fluids. Answer: B. Start norepinephrine infusion. Rationale: adequate fluid resuscitation has occurred. CVP adequate. Persistent MAP less than 65 requires vasopressor therapy. Question 12. A client in cardiogenic shock is receiving dobutamine. Which finding indicates the medication is effective? A. Decreased urine output. B. Increased pulmonary crackles. C. Increased cardiac output. D. Decreased heart rate. Answer: C. Increased cardiac output. Rationale: dobutamine improves myocardial contractility, increasing cardiac output and perfusion. Question 13. Which assessment finding differentiates neurogenic shock from hypovolemic shock? A.
hypotension, B. bradycardia, C. altered mental status, D. decreased urine output. Answer: B. bradycardia. Neurogenic shock causes loss of sympathetic tone resulting in bradycardia. Hypovolemic shock causes tachycardia. Question 14. A septic client develops mottled skin and decreasing urine output despite treatment. What does this indicate? A. recovery phase, B. compensated shock, C. progressive shock, D. anaphylaxis. Answer: C. progressive shock. Organ dysfunction signs indicate progression despite compensation. Question 15. Which hemodynamic profile is consistent with hypovolemic shock? A. high CVP, high PAWP, B. low CVP, low PAWP, C. high CO, low SVR, D. high PAWP, low CO. Answer: B. low CVP, low PAWP. Volume depletion reduces preload pressures. Question 19. Which lab value indicates disseminated intravascular coagulation, DIC, in sepsis? A. elevated platelets, B. prolonged PT and low fibrinogen, C. elevated hemoglobin, D. low D-dimer. Answer: B. prolonged PT and low fibrinogen. DIC consumes clotting factors, prolonging coagulation times. Question 20. Which intervention is priority in obstructive shock due to tension pneumothorax? A. intubation, B. needle decompression, C. IV fluids, D. epinephrine infusion. Answer: B. needle decompression. Immediate decompression relieves life-threatening pressure. Question 21. A client in septic shock has MAP 72 mm mercury, but lactate remains elevated. What does this indicate? A. adequate perfusion, B. ongoing tissue hypoxia, C. fluid overload, D. respiratory compensation. Answer: B. ongoing tissue hypoxia. Rationale: elevated lactate reflects persistent cellular hypoperfusion. Question 22. Which medication is first line for cardiogenic shock post-MI? A. dopamine, B. norepinephrine, C. dobutamine, D. phenylephrine. Answer: C. dobutamine. Rationale: improves contractility and cardiac output. Question 23. Warm, flushed skin in early septic shock occurs due to A. vasoconstriction, B. increased SVR, C. peripheral vasodilation, D. bradycardia. Answer: C. peripheral vasodilation. Rationale: inflammatory mediators cause vasodilation. Question 24. A client with hypovolemic shock becomes confused. This indicates A. improved perfusion, B. cerebral hypoxia, C. fluid overload, D. anxiety. Answer: B. cerebral hypoxia. Rationale: altered mental status is early sign of decreased cerebral perfusion. Question 25. Which MAP reading indicates adequate perfusion in septic shock? A. 55 mm mercury, B. 60 mm mercury, C. 65 mm mercury, D. 70 mm mercury. Answer: C. 65 mm mercury. Rationale: target MAP greater than 65 mm mercury. Question 26. A client develops urticaria and hypotension after antibiotic infusion. What is the nurse's first action? A. Stop infusion. B. Administer epinephrine. C. Give antihistamine. D. Start oxygen. Answer. A. Stop infusion. Rationale. Remove the triggering agent immediately. Question 27. Which ABG indicates worsening shock? A. pH 7.45. B. HCO3 24. C. Lactate 1.2. D. pH 7.25. Answer. D. pH 7.25. Rationale. Acidosis reflects hypoperfusion.
Question 28. A septic client's urine output drops to 10 milliliters per hour. What does this indicate? A. Renal hypoperfusion. B. Adequate fluid status. C. Recovery. D. Anxiety. Answer. A. Renal hypoperfusion. Rationale. Oliguria signals organ dysfunction. Question 29. Which finding is most concerning in cardiogenic shock? A. HR 110. B. Crackles. C. Chest pain. D. MAP 50 millimeters per mercury. Answer. D. MAP 50 millimeters per mercury. Rationale. Severe hypotension threatens organ perfusion. Question 30. Elevated CVP in cardiogenic shock indicates A. Fluid deficit. B. Right ventricular failure. C. Vasodilation. D. Dehydration. Answer. B. Right ventricular failure. Rationale. Poor pumping causes venous congestion. Question 31. Which is hallmark of late septic shock? A. Warm skin. B. High CO. C. Cold clammy skin. D. Bounding pulses. Answer. C. Cold clammy skin. Rationale. Late phase becomes hypodynamic. Question 32. Best indicator of adequate resuscitation. A. Heart rate. B. Blood pressure. C. Urine output greater than 0.5 milliliters per kilogram per hour. D. Respiratory rate. Answer. C. Urine output greater than 0.5 milliliters per kilogram per hour. Rationale. Reflects organ perfusion. Question 33. Which medication increases SVR? A. Dobutamine. B. Norepinephrine. C. Milrinone. D. Nitroglycerin. Answer. B. Norepinephrine. Rationale. Potent vasoconstrictor. Question 34. A client with septic shock develops platelet count 40,000. What complication? A. ARDS. B. DIC. C. AKI. D. MI. Answer. B. DIC. Rationale. Thrombocytopenia suggests consumption coagulopathy. Question 35. Which shock type shows decreased SVR? A. Hypovolemic. B. Cardiogenic. C. Septic. D. Obstructive. Answer. C. Septic. Rationale. Distributive shock causes vasodilation. Question 36. Primary treatment for hypovolemic shock from hemorrhage. A. Vasopressors. B. Blood transfusion. C. Diuretics. D. Beta blockers. Answer. B. Blood transfusion. Rationale. Replace volume and oxygen carrying capacity. Question 37. Elevated lactate primarily reflects A. Hyperventilation. B. Anaerobic metabolism. C. Kidney failure. D. Hyperglycemia. Answer. B. Anaerobic metabolism. Rationale. Occurs with tissue hypoxia. Question 38. Which is earliest sign of shock?
A. Hypotension. B. Tachycardia. C. Anuria. D. Cyanosis. Answer: B. Tachycardia. Rationale: compensatory mechanism. Question 39. A septic client requires vasopressor via which access? A. Peripheral IV. B. Central line. C. PIC optional. D. IM route. Answer: B. Central line. Rationale: prevent extravasation injury. Question 40. Obstructive shock from cardiac tamponade requires A. Diuretics. B. Pericardiocentesis. C. Beta blockers. D. Fluids only. Answer: B. Pericardiocentesis. Rationale: remove compressing fluid. Question 41. Which finding signals worsening perfusion? A. Cap refill less than 2 seconds. B. Clear lungs. C. Decreasing LOC. D. MAP 70. Answer: C. Decreasing LOC. Rationale: brain highly sensitive to hypoxia. Question 42. First action in septic shock bundle. A. Vasopressor. B. Antibiotics. C. Measure lactate. D. Intubate. Answer: C. Measure lactate. Rationale: early detection of hypoperfusion. Question 43. High PAWP indicates A. Fluid deficit. B. LV failure. C. Vasodilation. D. Sepsis. Answer: B. LV failure. Rationale: increased left-sided preload. Question 44. Which shock shows bounding pulses early? A. Septic. B. Cardiogenic. C. Hypovolemic. D. Neurogenic. Answer: A. Septic. Rationale: vasodilation increases pulse pressure. Question 45. Urine output 20 ml per hour indicates A. Adequate perfusion. B. Renal compromise. C. Recovery. D. Anxiety. Answer: B. Renal compromise. Rationale: less than 30 ml per hour is concerning. Question 46. Primary cause of death in septic shock. A. Hypoglycemia. B. Multi-organ dysfunction. C. Arrhythmia. D. Hypertension. Answer: B. Multi-organ dysfunction. Rationale: persistent hypoperfusion damages organs. Question 47. Which finding suggests fluid responsiveness? A. CVP 15. B. Passive leg raise improves BP. C. Crackles. D. JVD. Answer: B. Passive leg raise improves BP. Rationale: indicates preload-dependent circulation. Question 48. First-line treatment for neurogenic shock hypotension. A. Fluids. B. Vasopressors. C. Diuretics. D. Beta blockers. Answer: A. Fluids. Rationale: restore circulating volume initially. Question 49. Septic shock with glucose 240 milligrams per deciliter requires A. No action. B. Insulin therapy. C. Dextrose. D. Glucagon. Answer: B. Insulin therapy. Rationale: maintain tight glucose control. Question 50. Which finding indicates recovery from shock? A. Lactate rising. B. Urine output increasing. C. MAP 55. D. Cool extremities. Answer: B. Urine output increasing. Rationale: improved perfusion restores kidney function. If you made it through all 50 questions, you're building serious clinical reasoning, and that's what passes the NCLEX. Shock and sepsis questions are not about memorizing definitions. They're about recognizing patterns. When fluids are priority, when vasopressors are needed, when lactate is telling you the patient is crashing, when MAP below 65 means immediate action. If this challenged you, good. Growth happens under pressure. Drop your score in the comments. Let me know which shock type still confuses you. And if you want an even harder NGN case study version, just say the word. Subscribe to MCQs Master 101 for more high-level NCLEX preparation. Until next time, stay sharp, think critically, and pass with confidence.